So in this video clip, we're going to talk about the recommended intake of protein. As far as the percentage of your calories that should come from protein, it's about 10 to 35% of your calories. As far as specifying how many grams of protein you need, the recommended dietary allowance is 0.8 grams of protein per kilogram of body weight. So what you do is you take your weight in pounds and divide it by 2.2. That will give you your weight in kilograms, and multiply that by 0.8. Now, on the slide it says kilograms of appropriate body weight. If somebody is very, very, very overweight, it would probably overestimate the amount they need. So if you're within a reasonable weight, the 0.8 grams per kilogram of your actual body weight is just fine. Now, the RDA was based on younger people. There's a lot of people that think that, a lot of experts that think that older people actually need more than that, more like 1 to 1.2 grams per kilogram. So I'd like for you to calculate your own protein RDA. You'll need to be able to do this for your exam. So basically there's two steps. Convert your body weight to kilograms. So divide your weight by 2.2 and then multiply that by 0.8. So you can pause this presentation and calculate that. So here's my protein RDA. Last time I checked, I was somewhere around 150 pounds. And so I divide that by 2.2. My weight in kilograms would be 68 kilograms. Multiply that by 0.8. That's 54 grams of protein. But I actually try to get more towards 1 to 1.2 grams per kilogram. Actually, a little bit more than 1.2 grams per kilogram when I'm working out a lot. And so that would be, I would multiply the 68 times 1 to 1.2 to get 68 to 82 grams per day as a good amount for me. I am, getting older, and so protein intake spacing for me is getting more important, making sure I get it throughout the day, and to prevent muscle loss with aging, adequate protein and resistance exercise is really important. So remember, in addition to the amount of protein, think about the spacing of protein throughout the day. Now, there are people with increased protein needs. These are athletes. We'll talk more about their specific protein needs a little bit later. Depending on the type of exercise you do, protein needs are typically increased. People with wasting diseases like cancer, where they're losing body proteins, need more. If your diet's only low quality sources of protein, like vegans, vegans don't consume products of animal origin, so most of their dietary protein sources, except for like soy, are lower quality. Because they're lower quality, they don't use the amino acids as efficiently, so they need about 20% more protein than the RDA. So most Americans get plenty of protein, about twice as much as they need. So as far as protein supplementation goes, that's usually not necessary, even with people who are trying to build body proteins. But protein supplements can be convenient. If you're doing weight training, you want to have a protein and carb source within about 30 minutes of your workout to maximize protein synthesis. And sometimes carrying around a packet of a protein powder that you can mix with water is convenient. Some people who don't get enough protein at breakfast, it'd be useful to add a protein powder, and have some type of beverage with some added protein. But the key is that muscle is built by working muscle. Excess protein intake or protein supplements will not increase your muscle unless you work it. Soy protein's gotten a lot of attention. There is some evidence that if you substitute about 25% of your animal protein intake with soy protein, that it may reduce your risk for cardiovascular disease. Soy protein has some interesting things. It contains a phytochemical called isoflavones. Okay, it has some estrogen-like activity. Basically what it does is this weak estrogen, the isoflavones are a weak estrogen, they bind to estrogen receptors on breast tissue, And so it displaces room for the body's own strong estrogen. So for that reason, the soy isoflavones may reduce estrogen-sensitive cancers. Okay. Sources of soy that are the healthiest: tofu, soy milk, soy flour, tempeh, miso. The texturized vegetable proteins, again, they're highly processed, and a general theme in nutrition is the more processed something is, the more likely it is down the line to be shown to have problems. Soy may have some anti-thyroid properties, so if you have thyroid disease, you may want to limit your intake. Doesn't mean you can't have edamame, but you wouldn't want to have a lot of soy every day. The recommended servings by some is 2 to 4 servings a week. Now, at our recent diabetes expo, a breast cancer survivor came up to me because I was making, a tofu scramble for people to try, and she said that her doctor told her, because she had breast cancer in the past, that she couldn't eat soy, and she was a vegetarian. Actually, the evidence that most of us are reading indicates that there is actually not a problem with eating soy after you've had breast cancer. Now, whey protein is interesting. That's the protein, it's one of the milk proteins. One of the proteins in milk. Whey and casein are the 2 milk proteins. There's some pretty good evidence that whey protein can enhance muscle protein synthesis. And the reason is because it has an essential amino acid, leucine. It's rich in leucine, and that seems to enhance muscle size and strength because it actually stimulates insulin production. Okay, next clip is going to talk about vegetarianism.